and we're joined by Commissioner of Administration Jay Dardenne this morning to talk about moving to Phase 2. Jay, that's good news, I guess, in most folks' books, correct?
That's very good news, I think. Obviously, it's been a slow process to kind of deal with this pandemic and deal with it in a responsible way that takes care of the health of the people of Louisiana. And this is the appropriate move, and this is consistent with the president's guidelines for what you look to move to Phase 2.
The president's guidelines are 2-week phases. We're doing it a little differently. Can you explain that?
Well, we're trying to make sure that there's a window of 14 days to be able to see what kind of progress that's being made, and obviously the governor's been very careful to try and follow the guidelines of the White House, but also to be responsive to Louisiana's unique situation. We were one of the biggest hotspots in the world several month and a half ago or whenever, and so we've had an excellent effort by the Department of Health, the health experts, who has kind of become the Dr. Fauci of Louisiana, and really having a very balanced approach to protecting people's safety and health, but recognizing the need to get this economy cranking.
What now is open? Phase 2 brings us back to what?
Well, basically, every business is open up to 50% capacity except for bars that don't have LDH food permits and breweries that don't have food permits. They're at 25% capacity. Pretty much everything else is now open at 50% capacity, everything from aquariums to zoos, including casinos and churches and restaurants and museums and bowling alleys, hair salons, tattoo parlors. I mean, every type of venue, that some of which have been excluded in previous phases, are now open at 50% capacity, still trying to maintain social distancing, and obviously with the caveat that if you've got a health condition or you're one of the folks who's at risk, you should be careful. You should remain at home and not necessarily go to these places simply because they're open again.
A little bit of confusion when it comes to the casino order. Now, it's 50% and 75%. So it's two different things. Do you know the exact breakdown there?
No, I don't, and I really don't want to venture into that because I'm not sure about the specifics, except I know it's 50% capacity and 75% machines, and it has to do with spacing and what type of dividers may be available in those areas. So beyond that, I'm not the one to answer that question for you.
Okay, let me ask you this about the money Louisiana has lost as a result of this. I know you can count beans when you have to. So how many beans short are we going to be, and how do we fill the gap?
Well, first of all, you got to remember the huge amount of money that came from the federal government. $1.8 billion came to Louisiana, and it did to every state. Every state got $1.25 billion, and then you got a little more based upon your population. Our number was $1.8 billion. That has nothing to do with revenue loss. It cannot be used for lost revenue. So you can imagine the state, in our revenue estimating conference, the state has estimated we lost almost $1 billion in revenue for next fiscal year. And so you can't use that money to directly replace revenue, but you can use it for expenses that were related to preparing for or mitigating or responding to the pandemic. The same holds true for cities and municipalities and parishes. Huge amounts of revenue loss that cannot be compensated from the CARES Act, but you can provide reimbursement to cities and parishes and governmental entities for efforts that they made to fight the pandemic, and we've set up a structure to allocate a portion of that $1.8 billion to local governments. The law provides up to 45% can be designated for local governments. That's what the governor did. A piece of legislation passed yesterday, last minutes of the session, that basically took $300 million of the 800 some odd million that would be allocated to local governments and created a pool to provide funding for businesses. That I haven't seen the final version of that. It was changed in a conference committee at the last minute. We'll be looking over that today, and the governor will be examining that bill along with a lot of other bills that passed during the session.
Could he veto it?
He could veto any bill that passed, but that's not to say he's going to do that, of course. Mm-hmm. But he's going to look carefully at all the bills, and that's one of them we're very interested in. We had concerns about that bill because it was very poorly drafted as it came over to the Senate and had a lot of holes in it. And as I say, I haven't read the final conference committee report yet. I'll do that first thing this morning when I get to the office. and we'll start evaluating how it impacts the program that we've set up to start reimbursing local governments, and that began yesterday. We started receiving requests, claims, proof from local governments about their expenditures, and we hope to be on a track to start reimbursing local governments in early July.
So how have you gotten requests from Shreveport or Bossier yet, and how soon will cities get some of this money?
I don't know if we've gotten Shreveport Bossier yet. I'm sure we will. We've certainly been speaking to them, and we had over 300 folks on a Zoom meeting we had a couple of weeks ago to explain the process. And we expect to be able to get some checks out as early as July. We have the first application period began yesterday on June 1st and continues to June 15th. By early July, we hope to have processed a number of those claims and start getting money out to these local governments. That's the aim of the game with this CARES Act money, was to react to the emergency and deal with the financial consequences of the pandemic. So we're planning and hoping and expecting to move very fast.
In addition to all of the pandemic issues with the budget right now, the special session is going to have to focus on a regular budget too, and that means regular things that we deal with on a yearly basis, something like the TOPS program. Is that safe moving forward with a budget plan in the special session?
Yes, it is, Greg. And really the budget challenge is, famous last words, but is not quite as big as it was in the regular session, because so much work was done on the budget during the regular session, it simply did not pass. So I'll be presenting the budget to the Appropriations Committee this morning. It'll basically be the bill that the House has already passed and sent to the Senate. So there's pretty good agreement among a lot of folks as to what the budget looks like. We were able to use a lot of the CARES Act money to defray the revenue losses that we've had. And I hope that the budget process is not going to be nearly as complex as it was in the past. We're still going to have over $80 million in cuts to various departments, and those are going to be real cuts. But the important things like TOPS and like Medicaid funding, funding for K-12 education, are all going to be intact.
You said earlier, I thought, maybe I misheard you, that the CARES Act money couldn't be used for lost revenue.
It cannot be used for lost revenue, but it can be used for reimbursing legitimate expenses related to the pandemic. And we had a lot of them, as you can imagine, with all the hospitals that were built out and all the work that was done. And the guidelines that the U.S. Treasury has issued in terms of how the CARES Act can be applied is very broad, and it allows for a lot of reimbursement for healthcare expenditures, public safety expenditures, that allowed us to use that money for a lot of the gaps we otherwise would have had in the budget. But it's not for reimbursement for specific lost revenue.
Do you anticipate some budget cuts that will impact Louisiana residents? Will see, oh gosh, our state had to cut this, so I can no longer get X anymore?
There are going to be some cuts that will have a bearing on the departments, but the answer to your question is no, you're not going to see the dramatic cuts where services stop, or departments have to make major reductions in what they're doing. $80 million plus in expenditures is not insignificant, but I think most of the departments are going to be able to manage that, and we'll have them walking very slowly through the process as this fiscal year begins, not knowing what the future holds. In fact, one of the bills that passed during the session that the governor will be considering requires us to report to the Joint Budget Committee every month a plan that would cut $100 million out of the budget in the event that we have a mid-year shortfall. We would be doing that process anyway, and I think it's a wise thing to do, to start thinking in terms of what if the economy doesn't recover quickly, what if we don't get any more money from the federal government, what if our budget estimates are too ambitious in the middle of the year and we have to make cuts. So we're going to be going through that process anyway because we're not sure what the future holds right now.
There are a couple of things that could produce some revenue that will be heading towards the governor, like sports betting across the state. Has the governor tipped his hand on some of these? Do we know some of the major ones that are coming to his desk, where he leans on those yet?
No, he hadn't made any particular statements about those recently that I've heard. Sports betting was widely held to pass and to become law in Louisiana, as it has in a lot of other states. I think that probably will happen. It's not a huge impact on the budget, though. You'd be surprised in the big scheme of things. I don't think the economists have anticipated that that's going to be a major windfall for the state, but it will be some additional revenue.
Jay Dardenne, Commissioner of Administration. Thanks for your time, sir.
Thank y'all. Good morning.
You bet.